I'm Dr. Meier from Third Coast Foot and Ankle, and today I'm going to break down a little bit of the science of why lasers have really entered medicine, specifically why they've entered more of the orthopedic realm of medicine quite significantly within the last few years. Now, lasers have been in medicine for many, many years, and we actually use lasers every single day. So if you go to the grocery store, you know, it's scanning our objects and telling us our prices. That's actually being done by lasers. But those are very low grade levels. Those are called level 1 lasers. As we increase the power and penetration of the laser, we're increasing its strength or we're increasing its level. So there's level 1, 2, 3, and 4 lasers, and each one of them have kind of their own properties. Now, here we have a level 4 laser, and this is something that is used in our practice here, podiatry or foot and ankle, but these are also the same lasers that you're going to be seeing in a lot of other facilities that are treating musculoskeletal disease. And the reason is that the level 4 lasers can penetrate deeper. So we're no longer dealing with things on the surface of the skin. This can actually penetrate 3 to 4 centimeters into the skin or below the layer of skin. That means it can reach the bones and the tendons and the ligaments and all these other injuries that can happen deep within our body. Now, what's happening when these lasers are entering our skin, it's not magic. And what it is it's energy. It's the transfer of energy, which is really, that's the background of all of life, right? It's energy being reproduced and performed in different ways. And so this light is creating photons or energy that is entering the cells, and then that energy is manipulating what those cells are doing at a very biochemical way. And so in this particular laser, we have 2 different lasers or light penetration going on. And then each one of those light creates a different level of energy, which then creates a different response in the cells. And so one, for example, is targeting the pain receptors. And so what it's doing is actually blocking those pain receptors or disrupting the way that they're working. And so that our body can't communicate from just that site that we're treating to our brain that there's pain. And so we're just basically cutting the connection between that pain signal. The other thing that it's doing though is that it is producing a chemical reaction within the cell to release these endorphins essentially that decreases our perception of pain too. So we're blocking it and then changing the way our body is perceiving it. Now, that's only one of the laser light lengths that is entering the body. There's also a second one with this particular model that then penetrates the cells to change its metabolism, right? So just like our entire body has a metabolism, and when we have a very active metabolism, we're very efficient and we're burning lots of energy and we're doing great things. We have a low metabolism, we're tired and we're dragging and we're not really getting much done. And so the purpose here is to motivate those cells to work harder and work faster and do their job better. And which cells we're targeting, of course, is those cells that are helping our body heal or producing the materials that are important for our body to heal. So for example, there's something called fibroblasts in our body that lays down this cartilaginous like tissue and helps that healing process. And so these cells are just working faster and they're like overdrive, so we can get through that healing process a little bit faster. So that is a very broad, basic overview of what laser is actually doing. I know it's kind of confusing to think that we're just shining light on something, but there's a lot of very deep, well-researched science behind lasers, and it's only expanding and they're only being more utilized in medicine. And so I think that this is going to be something that's going to not only be here to stay, we're going to continue to see it as a therapy option, but it's actually going to become a primary treatment option. And the primary reason I see that in the future is that this is non-invasive and it has a very low risk involved, right? So there's a very few people we can do laser on. There are some contraindications, but for the most part, we're not causing tissue damage when we're doing this, and there's no side effects to this therapy that could potentially lead to damage. Specifically with the MLS laser, it is not a heat generating laser, which when we get to these higher levels, that's the new conundrum to attack, is how to get this level of functionality without this energy also creating a byproduct of heat, because heat can be damaging in many different ways. So the MLS laser here has kind of broken that barrier where we can get these high level lasers without that production of heat, without those side effects or risk factors, completely non-invasive, and it's painless to go through. So you're not feeling anything, physically other than that pain relief when you're undergoing these treatments. So if you haven't had laser therapy and you're interested about learning more about whether or not it's an option for you for your foot and ankle pain, please feel free to explore our other videos or reach out to us here at Third Coast Foot and Ankle, where we treat patients with lasers every single day. If you have experienced laser, we would love to hear your story and the benefits that you've had. So leave some comments in the video to share your experience with us and our friends. So thanks for listening, and we hope to see you soon.